Hi,
Hi.
my name is Erin. I'm going to be the nurse practitioner caring for you today. Excuse me while I just clean my hands. Could you please tell me your name?
Amy Marino.
It's nice to meet you, Amy.
Nice
And
to meet you.
what is your birthday?
8/18/63.
Okay. What brings you in?
Just a general checkup.
Okay. Do you experience any pain right now?
No problems.
Okay. So just to start, I'm going to ask you a series of questions just to understand your orientation status, and then we'll go from there.
Okay.
Could you please tell me the date today?
February 20th, 2020.
Okay. And who is our president?
Donald Trump.
And where are you at this time?
In a clinic.
So first I'm going to start with assessing your face, and at first look I don't see any discoloration, skin is clear. Okay, next we're going to move to the scalp. I'm going to assess your scalp. Okay, no abnormalities noted. Any tenderness?
No.
Okay. No masses present upon palpation. Her hair is soft. She appears to be well groomed. Next, I'm going to move on to your face. As I palpate your maxillary sinuses, do you experience any tenderness?
No.
Okay, very good. And now I'm going to look at your eyelids, your eyelashes, and your eyebrows. As I assess them, I can see that your hair is evenly distributed. I don't see any abnormalities. They are symmetric between the two. Okay. I'm going to look at your conjunctiva. It is pink. Your sclera is clear, as well as, just check your cornea. Okay. If you could please follow my finger. Okay. All right, pupils are round, reactive to light. They are equal and they accommodate. Moving on from there, if you could please smile for me, puff your cheeks, very good, raise your eyebrows, squint very hard. Okay, cranial nerve 7 is intact. Next, I'm going to assess your mouth. First that I see, your lips are, there's no cracking, there are no lesions present. If you could please open your mouth for me. Very good. Okay, it appears she has good dentition. No bleeding of the gums. Okay. Lift your tongue up for me. Very good. Assessing the hard and soft palate. They are pink and moist. Can you stick your tongue out? Very good. Assessing the posterior pharynx and the okay, and I also visualize the tonsils, and they are 0. If you could open up and say ah. Very good. Okay, her cranial nerve 9 and 10 are intact. The uvula rises when she says ah, and it is midline. Next, I'm just going to have you push against the stick. Very good. Okay, cranial nerve 12 is also intact. Next, we are going to move to the ears. Please tell me if you experience any tenderness as I palpate. Any tenderness?
Nope.
Okay, very good. In bilateral ears, the cone of light is visualized, the auditory canal is pink, and her tympanic membrane is pearly gray, and her ears are symmetric. Next, we are moving towards the nose. As I assess her nose, I can see that it is symmetric. Could you take a deep breath in through your nose? Very good. Okay, and lean your head back just a bit. All right. All right. Mucous membranes are pink. There's no drainage noted, no deviation noted, and patent turgency. Next, I'm going to be moving on to your neck. If you could please tell me if you experience any tenderness as I palpate the lymph nodes to determine if there's any edema or masses. Trachea's midline. Okay. Upon palpation, there are no masses, no abnormalities noted. Okay, I'm going to assess your thorax. If you could please take a deep breath. Good. And one more. Okay, her breathing is symmetric. It is not labored. As I assess the skin of her thorax, skin is clear, temperature is warm, no abnormalities noted. Okay, very good. Next, I'm going to move on to assessing your lung sounds. It's going to be a lot of breathing. If you could just take nice deep breaths in and out. First, I'm going to assess posteriorly, and then we'll do anterior. Now breath sounds on the front. Thank you. Breath sounds, both anterior and posterior, are clear. There are no adventitious breath sounds, so no wheezing, no rubs, no crackles. Next, I'm going to be moving on. I'm going to palpate your apical pulse. She has a rate of 70. Next, I'm going to auscultate. Apical pulse S1 and S2 are noted. Okay, next I'm going to auscultate the rest of your heart sounds. You can breathe normally. First is the aortic. Pulmonic. Erb's point. Tricuspid, and mitral. All heart sounds S1 and S2 are noted. No rubs, gallops, or murmurs heard in any of the heart sounds. So next I'm going to move on to assessing your upper extremities. I'm going to have you put your arms out, bend. Any pain?
Nope.
Okay, push against my hands, thank you. And push, very good, okay. Full range of motion to the upper extremities without any pain noted. So I assess her skin temperature, it is warm, equal. Next, I'll assess her skin turgor. There's no tenting noted. Radial pulses are equal bilaterally, +2. Capillary refill is less than 3 seconds on both hands. Next, we are going to move to your lower extremities. If you could just apply that for me. Thank you. Okay, we're going to start with this leg. Go ahead and bend it. Good, and straighten. Okay, this one. Bend, straighten. Any pain when we do that?
Nope.
Okay, so she has full range of all 4 extremities. That full range of motion, no clicks present. Next, we're going to move on to the skin temperature of the lower extremities. Just warm. Assess for tibial edema. She's not having any edema present. The posterior tibialis pulses are present. They are equal bilaterally at +2. Dorsalis pedis are also equal bilaterally, and they are +2. Next, I'm going to assess capillary refill, which is both less than 3 on bilateral feet. First, I'm going to start assessing the abdomen to check for contour and symmetry. As I assess, her abdomen does appear to be symmetric. I'm going to listen in all 4 quadrants for your vowel sounds. Okay, all 4 quadrants have normal active vowel sounds. Always start with inspection, then we go to the auscultation. Next thing that we're going to do is palpate. If you could please let me know if you feel any tenderness, because I am going to be pushing on your abdomen. I'm checking for any masses and tenderness. And her liver appears to be of normal size, does not appear to be enlarged. Okay. Thank you very much.
Thank you.